Welcome to the Pharmacy Leaders Podcast with your host, Tony Guerra. The Pharmacy Leaders Podcast is a member of the Pharmacy Podcast Network, with interviews and advice on building your professional network, brand, and a purposeful second income from students, residents, and innovative professionals.
Hey, welcome to Pharmacy News Sunday. It's Saturday again. But I wanted to first congratulate everybody that went through the second round of the match. I know there's about 400 or so people, I think, that matched in that. And I kind of wanted to go over the numbers and just talk a little bit about the whole residency process. So my source of information here is the ASHP press release that came out on April 12th. So it says 4,777 students matched with 2,300 pharmacy residency program, and it was in two different phases. But what concerns me is that it says that over the last 5 years, residency positions have increased by 1,450 or 43%. That's a huge number. If you're talking about a total of, let's do easy math. So 1,500 positions increase, 4,500 match. That means that 5 years ago, there were 3,000 positions. And now, 5 years later, we have 4,500 positions. My concern is that that means that many more people are graduating July 1. And so everybody that's in pharmacy school and is going to an employer without the residency is saying, oh yeah, I'm available sometime mid-May, maybe even early June. But these residency-trained students can't work until July 1st. And I'm wondering if that's an issue because I'm hearing anecdotally that there are some residents that are having trouble finding positions. And I just don't know if we've pushed the clinical boundaries a little too far. Obviously, from school's perspective, we want to have the best trained pharmacists for this upcoming clinical wave, I guess if you want to call it, as we work towards provider status. But what I'm saying is, in the last 5 years, are there 1,450 more clinical positions that these residency-trained pharmacists are going to fill? And I just don't know. And I'm not sure. Where I'm seeing the growth is in community, where a community resident will actually start doing a lot of entrepreneurial work to kind of create their own position. And I'm seeing that kind of expansion. And I'm just too ignorant to know what's going on in hospitals. So I'd just be curious to see how the job market's going for those residents who are looking to finish their residency up here in, so let's see, more April, middle April, April, May, June. So May, June, 2.5 months, you'll be out in the job market, then 6 months later paying student loans. So I'm just kind of curious, you didn't do PGY-2, or maybe you're leaving PGY-2? If anybody wants to talk about that. So 2.5 months from now, you should be working in something. And I just wonder if we've overgrown those positions so quickly, because the title of it is, Pharmacy Residency Match shows steady growth in postgraduate training. Well, that's good and well that we're getting more training, but how are we preparing for the jobs that are available? And are the jobs that are available residency jobs, or are they jobs that are non-clinical like mine? Or I just don't know. So I'm just really concerned when I see exponential growth of something, and I don't see exponential growth of maybe the job that we're preparing for. So I could be completely wrong. All these people could have great clinical jobs, clinical positions, and be in fantastic shape. So I don't know. I'm just kind of curious to know how the PGY-1, PGY-2 job market is post-residency, kind of report on that. So on Pharmacy Leaders Podcast this week, we've got second part of author-speaker Joanna Penn from the Creative Penn, continuing to talk about how you can kind of get into writing or getting into becoming author entrepreneur. Again, she around 2006 decided that she was done with her 13 years of cubicle job working for a mining company, I think, in Australia, and started her road to becoming a well-known author and making, I think, double six-figure income. I'm not sure, but certainly doing very well. And she's just fun to talk to and just fun to listen to. And she's from England, so it's got, of course, the great accent that really makes it so fun to listen to her, and just her enthusiasm. She's just someone I love to listen to, and I have 4 of her audiobooks. On Wednesday, we have Dr. Rajiv Kurapati, who is the author of Physician. That's the title of it. And as we're looking towards interprofessional work, we really need to know a lot more about the physician, the profession of physicians, how we can work with them. And we kind of talk about his book, and his book really takes you from the beginning to present day. So how physicians kind of got into their practice, the fracturing, so where does nursing fit in, where does pharmacy fit in when everything became just too big, and then what's going on in the future. There are certain professions that, especially even in medicine, that are certainly threatened by things like AI, where radiologist, instead of having a second radiologist look at a film, you would have the AI be the second radiologist. But in areas like psych, we certainly have, well, unfortunately, we have underfunding, but I think we also have a shortage of practitioners. So that was fantastic. I always like to bring in on a physician. And then taking it a little different direction on Friday, we've got a pharmacist and comedian, former Texan, LA-based Mahesh Katagi, on the creative career. So he is a practicing pharmacist, but he has New York and LA representation, and I can't tell you how big a deal that is. You don't just get an agent. It doesn't work that way. He certainly worked on his craft, but also he gives some tips on making that kind of a career move. So coming to the mothership and the Pharmacy Podcast Network. Fit Pharmacist was on Monday talking about ending hunger and food waste in Pittsburgh. And interview with Deanne Mullins with Aaron L. Albert. And Deanne Mullins is the former, I want to say, president of NCPA. I don't remember her exact title, but she's also a pharmacy owner. What is it like to be pharmacy owner, mom, president, all of these things. And then talking a little bit about building a successful community pharmacy practice with Nicole McClure, who is GRX Holdings up here in West Des Moines, literally 10 miles away or 15 miles away from where I am here in Iowa, so that's kind of cool. And she has some great interview there. And then we hear Carlos Aquino from Pharmacy Diversions LLC, who's talking about DEA documentation requirements. So that is the mothership. And then Christopher K. Lee, MPH, CPHQ, wanted me to let you guys know about an event. So it's MACRA, Impact on Healthcare Providers. And if you are a Californian, this is in the San Diego area. It's on Thursday, April 19th, 5160 Federal Boulevard in San Diego, the Family Health Centers of San Diego. It's in the evening, 5:30 to 7:45 p.m. Nick Macchioni, who is the director of the County of San Diego Health and Human Service, is the moderator. And then there are 3 panelists: the Chief Medical Officer, Dr. Ashby Wolf, Nurse Practitioner, Jan Sebring, and Operations Manager at UCSD, Vanessa Schatzberg. So very inexpensive. If you're a student, $15. Even if you're a non-member, $35. But interesting, talking about MACRA and really how it is that as health professionals we can work together. TLDR Pharmacy, again, watch for their diabetes guide, which just came out a couple weeks back. And there's, of course, the free pharmacist guide to U500 insulin if you want to look at that. Jackie Boyle, the pharmacy girl, has moved. She is now with the Happy PharmD, so partnering up with Alex Barker over there. And so any reports from the blogs I'll be giving from thehappypharmd.com. She's really been a great interviewer, and just so important to kind of find your tribe in this environment. So obviously I'm part of the Pharmacy Podcast Network. Todd Urey started that, 2009, and he has been a great mentor to me. So as you're looking for your entrepreneurial journey, or you're looking towards figuring out what it is you want to do in addition to maybe your daytime pharmacy job, I always recommend either joining a group, getting a mentor, something like that. So I'm very excited for her. I know how excited she is about coaching one-on-one, and that's, I don't want to say it's just something I don't do, but I don't. I'm working so hard on my book, so I spent from 4 to 6 a.m. 4 to 7 a.m. this morning. I was editing because I'm in the middle of getting the audio book out. So 4 to 7 this morning I did editing, and now again 5 to 7 p.m. I'll do editing, and then probably, 10 to midnight tonight I'll do more editing, and just making it so that it's a script. So turning a book into an audiobook script is tremendously difficult in terms of, I want to find a quote for you. There's somebody that said, if you need me to speak for an hour, here's the quote. It was Woodrow Wilson. If you need me to speak for 10 minutes, I need a week for preparation. If 15 minutes, 3 days. If half an hour, 2 days. If you want me to talk for an hour, I'm ready now. And that's so true. When you have 1.2 million words in a pharmacology textbook, I don't want to say that's easy. It's obviously hard to manage. But, there's a lot of stuff that I could cut a pharmacology textbook like that in half and not lose a single bit of content. It's just they talk in passive voice, they talk with big words and all that stuff. I prefer to talk directly, succinctly. So I'm going through StyleWriter, Grammarly, using all of my undergraduate master's degree in English to make sure that this script is concise, we're articulate, it's engaging, that you will be able to, because I'm asking you to listen to pharmacology for somewhere between 7 and 10 hours. I can't have passive voice in there at all. Zero passive voice. It's all gone. So working really, really hard to make pharmacology, memorizing pharmacology mnemonics, a great review for you. And hopefully I'll have it for you before graduation. Looking to try to do that and finish it by the end of this month. I was really impacted by the Talk to Your Pharmacist podcast this week. Hillary Blackburn interviewed Erin Hendrick, and something that she was talking about that I kind of really kind of connected with was she graduated from pharmacy residency, Erin Hendrick, at the same time her husband began residency in medicine. So she followed him in his residency, and then followed him in fellowship, and followed him to a job. And she had to change her job 3 times. And I did not make any, I don't want to say the sacrifice was the same in any way. But when I moved to Iowa, I had 4 jobs within the first 2 years. And it was just really nice to have a flexible degree. And this is in the middle of the housing crisis, and I was able to get 4 different jobs with a pharmacy degree. So I just would really love to hear from those spouses that are kind of being tossed around a little bit because they have to go here or they have to go there, and I would just be really interested to hear. But I guess it was kind of I appreciate what you had to go through. And then at the end, she ended up being the COO of a company, and then now she's with a different company. But really, really inspiring interview. So I really recommend that you listen to Hillary Blackburn. Just in general, the Talk to Your Pharmacist podcast always has some great material. Pharmacy demand indicators, the same. I don't know what's going on Q1 for this year. Again, jobs were up from Q3 last year. So I'm just kind of curious how that... And these are general jobs, these are manager jobs, these are specialized jobs. So I really don't have any data for a post PGY-1 or post PGY-2 resident. Like, great, you're getting another year of training, but I want to know that you're getting jobs that you're satisfied with, that you want. I want to know that those things are happening. And obviously, provider status, CEO APHA has been sending out letters. Make sure that you do contact your congressperson to let them know how important this bill is. And I think they're trying to attach it to an opioid bill. So just not sure exactly the intricacies of that. We're down to 8 seats available in the pharmacology class I teach over summer. So if you want to take pharmacology with me, you can go to memorizingpharmacology.com, look at online course, and then you can see the syllabus and a little bit about the contact and any links that you need there to enroll. It says staff, but I'm teaching it. And it's just a thing with regards to summer. We don't really get put into the system until a lot later or a lot closer to that start date. But that starts in May and it ends in August. It's only a 10-week program, so hopefully it fits into your schedule. But if you want to take online pharmacology with me, I'd love to have you as part of the last 8 students in class. Let's see. Okay, and then I have a new YouTube video that kind of talks a little bit more about the syllabus itself. Kevin Yee was answering a couple of different questions, asking about money questions, asking about pharmacy questions. So these were really long. It was like an hour for the Ask Me Your Pharmacy questions that he streamed like 6 days ago. So he's been rocking the microphone lately. Okay. Let's see. I think that's everything I wanted to cover for this week. So again, excited to have an author who paired with a physician to write a book about being a healthy writer, which is really the same thing. It's really honestly being a healthy person, staying in the same place all day long. And then on Wednesday, having a physician author come on and talk about how we can work with physicians. And then on Friday, so excited to have comedian Mahesh Katagi come on. Check him out on YouTube. He's got a great 5-minute bit, and he's a Texan, and the material that he has, it's not pharmacy related. Some of that stuff kind of fell flat he was talking about in the interview, but he's a funny guy, and I think you'll appreciate that. So have a great weekend, and look forward to hearing from your emails. And again, the best way to get in touch with me probably is Facebook Messenger. As long as you don't have like a creepy profile where it's just like, the same picture over and over again, I'll be happy to add you as a friend. So talk to you next week.
Support for this episode comes from the audiobook Memorizing Pharmacology, a relaxed approach. With over 9,000 sales in the United States, United Kingdom, and Australia, it's the go-to resource to ease the pharmacology challenge. Available on Audible, iTunes, and Amazon.com, in print, ebook, and audiobook. Thank you for listening to the Pharmacy Leaders Podcast with your host, Tony Guerra. Be sure to share the show with the hashtag #PharmacyLeaders.